Good morning, I'm Adam Sexton. Nationwide efforts to quell the COVID-19 pandemic continue as the death toll from this virus continues to rise. Joining us this morning to talk about what's being done in Washington and how much more work we have ahead is Senator Jeanne Shaheen, joining us from home. Thank you, Senator, for joining us this morning.
Good morning, Adam. Yes, there's still a lot of work going on. We passed $2 trillion in what's being called the CARES relief package 2 weeks ago, actually, yesterday. And the challenge now is to make sure that that gets implemented and that it gets implemented in a way that the help goes to the people who are most in need, that they get it as soon as possible. I worked on the Paycheck Protection Program to try and help small businesses. And while we've had a lot of small businesses in New Hampshire who have had their loans approved, we still have very many people in the queue, and people are still waiting to get their money. So we need to get that money out the door. We need to allow them to keep their employees hired and on their payroll so that when they're ready to start back up again, they've got the workers that they need.
And Senator, what's going on with the Small Business Administration right now? What is the delay? Is it just the sheer volume of what's going on? What's making it so difficult for the executive branch to move this funding?
I think that's a lot of it. It is the biggest program that the Small Business Administration has ever tried to roll out. We've never done this before. Now we provided additional resources so they could hire people, so they could get their systems up and working. But we rolled out this, or the SBA rolled out this program a week ago today, and they're trying to get, tens of thousands of loans approved and the money out the door. I had the opportunity yesterday to ask Secretary Mnuchin whether they were going to be able to provide liquidity to some of our small community banks, because that's one of the concerns I've heard in terms of providing loans to people. They want to make sure that the regulators are not going to come down on them if they exceed their loan limit. And he assured me that they are going to provide those assurances, that they have posted some changes yesterday, and that the small community banks should be reassured that they can go ahead and make those loans. But we need to get money out the door. We need to get the money to the people who are hurting. As we know, we've had over 100,000 people in New Hampshire apply for unemployment insurance. We've got small businesses who need to pay their rent. We've got families who want to put groceries on the table, and they need the help that's in this package. We need to get it out the door, and we need to push on the administration to make sure that happens.
What about the direct assistance to individuals? So many people are interested in when that's coming in. And on top of that, do you think this is going to be enough, this first relief package, or is Congress going to have to come back together and pass another one?
Well, I think we're going to have to come back and do another round of help. We need to see when we think we're going to be past the worst of this pandemic, and we need to make sure that businesses have the help they need to keep their workers hired and on the payroll, and that they're able to start up again. So we need to follow very closely what we're going to need, and we also need to see what's working and what's not working. We know that the SBA needs additional help to get these dollars out the door. We know that the IRS needs to get those rebate checks in direct deposit, get them out to people who need them. And so I think we probably are going to need another round of assistance. And I think people are already talking about that, planning for that. As I've been talking to people around New Hampshire, I've been asking them, what do you need? What kinds of changes should we be looking at as we're thinking about another package of relief? And so we're gathering those ideas, those needs, so we can share them in Washington.
Another issue the Granite State is having with Washington right now has to do with these rapid testing machines that FEMA sent to the state, and Governor Sununu is saying he's banging his head against the wall because the state got 15 of these machines, but only 120 or so cartridges necessary to conduct the tests. You've jumped in on this in trying to get FEMA to send more. What's the issue here? Is it just a problem of just not enough cartridges and they're having to go elsewhere where the COVID-19 problem is more severe, or how do you get more of these things?
Adam, it's a frustration that I know we've all had since the beginning of this pandemic. Not enough testing and not enough personal protective equipment. The two things that we really need the federal government to help with. And so far, we have not seen the testing ramped up in the way we need it. Those 120 test kits that they gave us, about 20 of them are needed just to calibrate the machine. So it's too little too late. We need more help, and we need not just the private sector to step up, but we need the federal government to respond here. And it's not just the tests that we need now as we determine whether people have the coronavirus or not. We are going to need antibody tests, those tests that determine whether you've had the virus and yet didn't display any symptoms. We're going to need those tests as we begin to ramp up the economy again, try and put people back to work. We've got to know who has immunity, who can go back to work without any problem, and who is still at risk. And that is going to be absolutely critical. Unless we have widespread testing for those antibody tests, that second test that we need to do, we're not going to be able to open up this economy in the way that we want to.
Whose responsibility ultimately is this? Because we've heard President Trump say a few times, you know, he's pushing this towards the governors and the states and saying essentially, well, if your state fails, then I'll step in.
Well, we had a national stockpile that we thought was going to provide personal protective equipment, that we thought was going to provide things like ventilators that were going to be available across this country. New Hampshire has had a very few of the personal protective equipment. The requests that we have made, not only have we gotten very little of it, but we've gotten gloves that couldn't be used in hospital rooms because they're latex and people have allergies to them. We've gotten N95 masks that were expired when they sent them to us. That's just not acceptable. We need the federal government to provide that kind of assistance. States have done a great job. I think in New Hampshire, the governor and everyone who's working on the emergency task force, they're doing a very good job under very difficult circumstances. But we need the federal government to provide some guidance. We need the CDC to provide guidance on how to deal with things like when you're in the workplace and you're essential employees. I had an opportunity to speak with Dr. Redfield, the head of the CDC, yesterday, to raise concerns that I've heard from first responders here in New Hampshire about source patients. When they get exposed to someone who may have the coronavirus, if they can't get a test for that person to find out if they're positive, then they have to self-quarantine. And for many of our police departments, our firefighters, we've taken those first responders out of their jobs, required that they self-quarantine. And for many of those departments, they're small. We don't have the ability to replace those folks when they have to self-quarantine. So I was urging him not just to give us guidance, but to ensure that the private labs also have that guidance so they can test those source patients, move them up on the priority, let our first responders know if they've really been exposed or not.
It's hard to imagine that healthcare is going to look the same when this is all said and done. And certainly we have a lot of rural hospitals here in New Hampshire, Lakes Region General Hospital already needing assistance from the state just to keep doors open. That's probably going to happen around the country. You've been a Medicare for All skeptic in the past, but with so much change going on and the potential to lose so much healthcare capacity in this pandemic, do you think it's time for the federal government to step in with a more robust role, because it's already going to have to pay for so many of these hospitals to operate? What does that look like moving forward?
Well, first of all, one of the things that we were able to get into the CARES package was additional help for the hospitals. It was one of the things that we disagreed about in the end that held up the package. But we've got $30 billion going out the door today, we're told, that are going to go. A number of those dollars are coming to New Hampshire to help our hospitals. They're on the front lines. We need to make sure that they don't go under. They're taking a huge economic hit because they've suspended all voluntary surgeries, and that's where a lot of their revenue comes from. So we need to provide that help. But one of the things that this pandemic should tell us is how important healthcare is to all of our lives, and how important it is to ensure that everybody can access health insurance at a price they can afford. And that's why the Affordable Care Act continues to be so important. I'm very disappointed that the administration hasn't opened up a special enrollment period for the Affordable Care Act, that they're still trying to overturn the law, which would affect, in New Hampshire, if you look at the expansion of Medicaid and the number of people enrolled in the Affordable Care Act, it's almost 100,000 people. we need to make sure people can get that health care when they need it. And I don't think the best way to do it right now is to totally overturn our healthcare system. To do that, I think there are much faster ways to ensure that people can get enrolled in health insurance and get the care they need.
You sit on the Armed Services Committee, and there are a lot of big problems to deal with right now. But do you think you'll be looking into this issue that happened on the USS Theodore Roosevelt, how the White House handled the firing of Captain Crozier, whose letter, a plea for help essentially for his COVID-19 afflicted ship, was made public, and he ended up being fired?
Yes, it's very distressing. We don't know all of the details behind that. We had a briefing by phone on Wednesday with the Armed Services Committee, and that was a question that I asked because there is an investigation underway. We were supposed to get the results of that investigation this week. They have delayed it. I asked specifically, when are we going to get the results of the investigation, and is it going to be made public, and is it going to be made public to members of the Armed Services Committee and to Congress? I think it should be made public. This is a big issue. We want to be reassured that our men and women who are serving in the military are going to be safe when they're deployed. And if their commanders speak up for them, we want to make sure that they're heard. So I'm looking forward to getting that report. I didn't get an answer on my question. I was told that they would get me an answer and get back to me, so I'm waiting to hear that.
And hindsight is always 20/20 here, but do you think at all that the impeachment process that we were going through in December and January might have distracted Washington from this bigger looming problem of the COVID-19 pandemic?
Well, I would hope at the federal level we can do a number of things, and we need to keep the operations of government going on despite what else is happening politically. So I think there are a number of signs that we should have known what was coming and they were ignored. I think now what's most important is for all of us to work together to continue to respond to this pandemic, to do everything we can to put it behind us, because we are not going to see stores open up. We're not going to see that we can go back to our everyday lives until we've defeated this disease. That's number one priority, and we've all got to work together to do that.
All right, Senator Jeanne Shaheen, thank you for joining us on Close Up, and we hope the next time we can have you here in studio when everything's going.
Absolutely.
Right, be well. Thank you for your time.